Hello, everyone, and good morning. Welcome to our presentation this morning, Colorado Tell Your Data Story, Combining Data and Stories for Health Equity. This is brought to you by the Colorado Equity Compass Project, where every story counts. In just a moment, we'll introduce our team and talk a little bit about what we'll be going over this morning. Before we do that, though, we just wanted to point out a couple of features. At the bottom of your Zoom, if you'll take a look, you should see some additional buttons, including captioning. You can activate that if you'd like to read and follow along as an accommodation. And also there's an interpretation button, which if you click on, you can either stay here for English presentation, or we have live interpretation in Spanish, which you can also access if you'd like. Déjame saber también cuando necesita direcciones en español en el espacio del chat. Okay. So here's our team this morning from Change Matrix. We have Rochelle Espiritu, our project director. I'm Scott Van Loo, also co-project director. We have Alina Taniuchi and Eve Kucharski, and a communication specialist. And our team this morning, we put this presentation here together for you. Would you like to introduce yourself a little bit?
Hi, Scott, thank you. This is Rochelle Espiritu. I'm one of the founding partners for Change Matrix, based in Denver, Colorado. My pronouns are she, her, and I'm excited to be with you all today and share a bit more about the Colorado Equity Compass. I'll pass it to Alina.
Thanks, Rochelle. Hi, everyone. I'm Alina Taniuchi. I use pronouns she, her, and I'm located in Denver as well. I'm excited to be here with you all. Eve?
Yes, my name is Eve Kucharski. Thank you so much all for joining. And I'm the only one who is actually not in Colorado. I am joining you from beautiful Seattle, Washington today, but Colorado in spirit. So thankful that you are all able to join us today.
Thank you so much, team. And again, I'm Scott Van Loo, located here in South Denver, and happy to be with you here today. And we can go ahead to the next slide. So just a few group agreements, if we could. We would love for you to stay on camera if you can. Otherwise, please put an asterisk by your name so that we know that you'll only be listening today. And you can do that on your own picture where the three dots are. You can click on that and hit the rename button to put the asterisk. And if you look further down, we're also asking if you could please put your pronouns also. Please interact in the chat when asked, and then save questions until the end of the presentation unless otherwise prompted. And again, we have live Spanish to English translation, and that's accessible just by pushing the interpretation button at the bottom of your Zoom. So we'd love to just hear a little bit from you. If you would please share your name and your pronouns again, if you're comfortable, the organization that you're affiliated with, the county in Colorado you're joining from, and a favorite thing about where you're located. Well, thank you so much. It's really wonderful to get connected in this way. And we're going to dive into how our data can connect us to, and how the CEC is also really closing that gap of where we live around the state. So Rochelle, I'll turn it over to you.
Thank you, Scott. So it's just wonderful to hear about all the different locations that you're joining us from today, and the beauty of Zoom, that it can bring us together around this interest of data. And so we're excited to share a little bit more with you about the Colorado Equity Compass. We've worked closely with the Colorado Trust for several years, and what they've been hearing from the communities in which they work is that community members are really interested in getting more localized data. That county level data often wouldn't tell the full picture of their community or their neighborhood. And so the Colorado Equity Compass was created so that we could get into more neighborhood, actual census level data that would be easily accessible to any person. And the effort really was around democratizing data, making it so that anyone could use it, could feel comfortable with it, use it for action and for decisions. And that it wouldn't be just a platform, just a website, but really an interactive platform where people could come together, look at quantitative data, look at stories, because we know that stories are what bring data to life. And so that was really the vision behind the Colorado Equity Compass. It brought together several partners in this effort as well. So Change Matrix, the company that Scott, Alina, and Eve and I are with, is the managing partner for this effort. And we have two other partners, the Colorado Health Institute, which is essentially our data partner. They kind of help us with all the information, the quantitative data that's on the platform. And then Consume and Create is our website and design and branding partner as well. And we're all funded by the Colorado Trust. So today we'll be sharing a little bit more with you about the interactive platform, the various tools that are available to you that would support your interests in looking at data, finding stories, understanding more about what social determinants of health look like in various communities, that will help support your work around health equity and anti-racism work. So we've always had equity in the center of the work as well. And so we'll point out to you as we go along different elements of the platform that help, one, tie the interest in social determinants of health, but also we'll show that the site is fully translated. You can access the site in both Spanish and English. And what we're hoping is that you'll be able to use this platform as a way to address systemic racism in your communities. So I guess the first part of our poll, and Alina, I'm hoping we have this poll set up, is around what part of the CEC, as I've kind of just described it. Well, you'll learn more about it too, but I guess it's more around what are you interested in, or what were you drawn to as you decided to join this webinar today. So I mentioned that we have information on social determinants of health, that data is available on the website, that stories and the opportunity to upload stories is another big feature of the website too. So just curious to hear from you, what kind of drew you to the CEC today? So it looks like we're getting a nice split between data sharing and story sharing as you're answering. I don't know if you can, it's a one choice thing. So it looks like we forced you to make a selection. And story sharing is actually coming up with 2/3, almost 3/4 of you indicating that. And then the data sharing is about 1/4 of you. So that's great. And I think that's a really unique thing about the Colorado Equity Compass is that, there are a lot of different data platforms out there. CDPHE has it, different state departments and local governments have data available. But what we were really interested in was the power of pairing stories with data. So it's great to see your interest in that as well. Great. So we're going to walk you through this website and specifically focus on a couple of things, really the Equity Data Navigator. But when you first get to the website, you'll just see our homepage, which provides pretty much an overview of what we do, any announcements that we might have, and an overview of social determinants of health as factors that impact our health. And then you'll also be able to see some of the recent stories that we have, and Eve will be talking a little bit more about that later. You'll also see a tool called What is Data Storytelling? And we'll talk more about that as well, as that's kind of the framework that's going to be used for the rest of our series, which will be continuing in the new year. And resources as well that we have curated to help support your data storytelling efforts. So first, we're going to go into the Equity Data Navigator. And this is kind of the the crux of the platform. This is where we house all of the data that we have put together, so that you could look at how your community is doing in terms of social determinants of health. And so as soon as you get in, you get to this space where you can explore equity in your own community. And so what you would do here is start to type in your county or the county of interest that you have. And so we're going to go to Arapahoe County. And once you're in the site, what will pull up for you is a map of that particular county. So you can see that on the left, and it's overlaid on a GPS map. So as you zoom in, as you can see, Alina is zooming in using the plus button over there and using her mouse to shift around. You can start to probably, if you're from Arapahoe County or familiar with it, you'll start to see landmarks, freeways, major roads, reservoir, so that you can kind of ground yourself in where you are in that particular county. So you can look at it from big picture, you can zoom in if you'd like. And as you look at the website, you'll also see on the right side our panels. So what we have here are key demographic sliders for the county or for whatever region you're looking at. And so on these panels, you'll see race and ethnicity, language spoken at home, the educational attainment of the area, bachelor's degree or higher. Then you go into education by race and ethnicity, and then median family income and median income by race and ethnicity. So this is all based on the latest census tract data. So this was recently updated with 2020 data.
Sorry, Rochelle, actually, it was up until 2019. There were some issues with new census tract drawing, like line drawing. So this is up 2015 to 2019 data.
Oh, okay. Okay. Thank you for that clarification, Alina. On the bottom, what you'll see are also the key outcomes that we're looking at. So what you see there are average life expectancy, self-reported good health, the percentage of people reporting good health, the percentage of people reporting good mental health, which is a new addition that we put in this latest launch, as well as a percentage of the racial diversity of residents. We like this because it gives you that quick snapshot of how a county is doing. In the little yellow pill, I think we call them graphic, what you see as well is the difference from the state average. So I can't read because my eyesight's gotten so bad, but there's like, you can see, I think this county is it below, Alina?
Everything's right about the same as the state, although it's above 8% above the state average for racial diversity of residents.
Okay. Yeah, great. Thank you. So that gives you a really quick key picture. And we've showed you how to navigate around. Now, if you scroll down on this page a little bit, what you'll see is what we call a tree graph. And so this tree graph highlights the various social determinants of health that are available on this platform. And you can see they're in broad buckets of economic, education, environment, and so forth. If you can see quickly as well, looking at this tree graph, how this county is performing in terms of being above the state average. So you see almost everything, with the exception of health services, are above the state average, with health services being slightly below. Now, if you click on one of those social determinants of health factors, you can see then the different metrics that went into comprising that particular factor. So for housing, you can see that it has housing affordability, percentage of houses that are affordable, not having a cost burden, as well as a percentage of housing units that are owner occupied. So you can just go through and look at that for each county and for the different components of social determinants of health. On this page too, if you scroll down a little bit further, if you will also see the 5 factors that would have the greatest association with self-reported health. And this data is available actually for the 10 most populated counties in Denver. So in Arapahoe County, higher education, median family income, registered voters, health insurance, and air quality have the strongest association with the health outcomes that we're looking at. So we wanted to provide that because in some way that could help the user think about, well, maybe these are the areas of focus that we might want to work on in order to really impact disparities in health. Okay, I think those are the main ones to look at. Let's click around on the website now, or on the platform here. So what is amazing about this site is that the data is available at the census level track. So if you're seeing Alina move around and click on various census tracks, you can see that data change. So she's in Olympic Park right now. You can see that the average life expectancy dropped a bit, as did the percentage of self-reported good health, and good mental health, I think, stayed about the same, but the diversity is about the same. But so you can click around on any one of these census tracks to take a look at how a particular neighborhood is doing. So, Alina, I think we were going to go first to West Green Village, or are we doing that later?
Yeah, I think we were just going to take a look at how just a census tract over, a neighborhood over, you can have different outcomes. So for example, in Arapahoe County, West Greenwood Village is right next to, sorry, my Zoom controls are in the way, is right next to Northeast Littleton. And you can see at a quick glance, just clicking between the two, the differences, they start to be highlighted as you kind of toggle back and forth between these two. You can go through all of these as well and kind of look at how that adjusts and changes as you click on both of them.
Yeah. So what we're hoping with this ability to kind of take a look at data at a neighborhood level to see these indicators really clearly and easily, or not having to look at a Excel sheets of census tract data, it makes it more visually appealing and accessible to the user. This can also help inform some advocacy or some decision making. So if a group is looking at the difference between Westwood or, working in Northeast Littleton and is saying, look at our data. Things are not looking as well. And we are just one neighborhood over from another community that has much higher outcomes. And it's the whole story around just the fact that your zip code can really determine your health. Again, Alina is now showing that you can look at the tree graph also in terms of the particular neighborhood that you're in. So now you can dig deeper into what it looks like in this particular neighborhood of Arapahoe County. And it's a very different story than what we saw when we were looking at the county data. In the county, everything was above state average. And now you see in this particular neighborhood that in terms of economics, food, health services, and housing, that this particular neighborhood has data that shows that it's performing below the state average. So we want to take a little bit of a break here and ask you to go into the platform. So we'll pop, Eve, if you could just pop the website address into the chat. We're going to do a little activity called Did You Know? So we're asking you to find a place of interest and find a piece of data that's interesting to you. So I've gone into, I can't remember what county it was now, but did you know that in Pitkin County, bananas cost 69 cents a pound? And bananas, the price of bananas to us, you're like, why are we using the price of bananas? But it is a good indicator of cost of living. And so you'll find that under one of the social determinants of health. So take a minute. That's something that we have highlighted on our Equity Data Navigator page, is some of the nuances or considerations that we all need to have have in our minds as we're looking at the data, and to be critical users of data and recognizing what some of the limitations are with the data that we even have on this particular platform, and what we have available to us, given some of the challenges that you noted, like who responds, who has, which populations are missing from this data. So important to be considering that when you're using this platform and any other data platform as well. Thank you for sharing. So what we wanted to do was next show you an easier way to compare regions to each other. So Alina is going to share her screen again. And we're going to show you how to do that comparison between Northeast Littleton and the Greenwood Village area. So you saw that she scrolled down, and here you would be in one particular spot, and then you would type in the other area that you want to see in comparison. So you could either copy it from where we were above, or we know no one knows their census tract numbers. And so we started putting in neighborhoods. We had some data sets that our CHI partner had where we were able to put in names of neighborhoods instead of census tracts. So that was an upgrade we did recently as well, which was helpful. But you can click on any one of those descriptions of the region and use that to put into the comparison section. And so here you get that better side-by-side way of looking at the data. And so you can see by scrolling down first, I always go to the blue bar first, that it's 74 years, almost 75 years average life expectancy versus 80.8 in Greenwood Village. So six, can't do math, difference in life expectancy. And you can see those differences in self-reported good health and mental health, as well as the racial diversity of the residents also. You can scroll through each of those demographic sliders and also look at it, compare side by side that way as well. The next part of what you will see down below is what we call our radial graph. And here you can also, it's just another way to look at a comparison of how these two census tracts compare to each other against the state average. So the yellow is the state average. Everything has been calculated to be a Z-score so that you can then see that the red lines are Northeast Littleton, and then the blue lines you can see coming out much farther, more above the state average, on that radial graph. We also really believe in making data accessible. So you can see that little download data button so that you can download the data to take a look at it yourself as well. Further down this page, you'll see all the social determinants of health. So again, if you want to do more of that side-by-side comparison, you would just click on the little plus sign and be able to see what the data actually looks like for each of those census tracts. And so really, the intention is that by having this side-by-side view, you can look at the data in a more contextualized way, real comparisons, not to say that one area is better or worse than the other, but where you might potentially look at intervening or looking for solutions, or to focus on a particular social determinant of health. And so the example earlier around looking at food systems and kind of that was something that had come up in the pilot that we had done when we were first launching CEC, was that one of our pilot communities thought that they lived in a food desert, but what they actually recognized as they were digging into the data more was that they lived in a food swamp where they had lots of access to not very healthy foods and more kind of fast food areas and dollar store opportunities to get food, which wasn't what they wanted for their neighborhood. So they use this data to kind of call that out and to advocate for making some changes there. While you're on this page, let's just highlight the change button. So if you were in this comparison area and you decided that you wanted to compare Northeast Littleton instead to the Arapahoe County, you could change that to Arapahoe County. and be able to then just see Arapahoe County pop up for you right there. So you could compare the neighborhood to the county, or if you wanted to, you could compare a county to a county. You can pretty much compare any census tract to any census tract or county in the area. And you can kind of just decide what your level of focus is. But there's, different levels that you might decide to look at this data. Right now, we're only set up to compare 2 counties or 2 geographic areas at once. We work with our website developer. They've done an amazing job of making this super accessible and easy to navigate. 3 might push them over the edge a little. I don't know what we're
It'll just be a great challenge.
I mean, they always come up with wonderful solutions, and that's why we love your questions, because I think it continuously pushes us to think differently about what people are interested in and what they might want to do. And so our next upgrade to this is probably going to be around kind of regional areas. So for example, if somebody was really interested in a school district and they wanted to look at their school district data, we're hoping that we'll get to this point where we can have some predefined geographical areas that would allow people to then download that, look at that data in the same way. Or a congressional district, if you want to go and advocate to your state legislator representative, it might be about looking at like your neighborhood in comparison to the congressional district, because maybe you want them to focus a little bit more in a particular area. So those are kind of upgrades or enhancements that we're interested in. And oftentimes we get these ideas from when we're in conversation with people that are using the data. Continue to explore around that and hope that you find some good information that helps you think about decisions that you're making or directions that you might be going. I'm going to go ahead and pass this over to Eve, who's going to talk a bit about, I think, the part that maybe many of you came in with interest around is the stories.
Yeah, thank you so much, Rochelle. Really appreciate the chance to get to talk to you about this. Alina, I know you're sharing screen. If you could just click over to the stories tab.
Happy to do that. I do just want to highlight too, we
sure.
didn't get a chance to mention this earlier, that actually on this page, and I think our modules got a little bit mixed up here, but we do actually have community stories, which Eve will talk about more, but they are tagged based on geographic region as well. So you'll see right now I'm in El Paso County. And then if I were to switch over to say, to Arapahoe County, you would actually find stories that are specific to that region as well. Want to make sure that you all have access to geotagged stories as well. The quantitative data doesn't necessarily tell the story of what's going on in each area. Sorry, Eve.
No, not at all. I appreciate you sharing. And actually, I do have a story from El Paso County that I'll sort of share as a sample if this is your first time sort of seeing the stories and community stories page. So really, first, I'd like to just sort of talk about why this aspect of the website was born. And really, while the Equity Data Navigator is super core to what we do, we know, even from just conversations we've had during this call, right, that it's not always the whole picture. Oftentimes data is not in perfect alignment with the actual experience of the community, which is why we decided to invite lived experience to the website to showcase more information. And in that case, that lived experience is through stories. So if you scroll through this page, you can find a huge variety of content. We have recipes, infographics, videos, podcasts, really anything you could think of that we allow for the community to share. Because we know that while the Equity Data Navigator, again, is great at looking at that, statewide, countywide, census tract level, essentially neighborhood-wide comparison sometimes, it does miss the realities of what it is to actually live in a community sometimes. And so in addition to getting sort of a richer idea of what people might be experiencing in regard to the social determinants of health through these community stories, it really allows also, by sharing these stories, for community members to share with their own voices what is going on in their communities, and possibly even share things like community interventions to issues that might be evident in the data navigator, but not so much so unless you actually take a little bit of time to research, which is really exciting. And what is, I think, my favorite part about this is that from an equity standpoint, it's really exciting because these are community stories that have been submitted by community members themselves. So these are not stories that the Colorado Equity Compass has written or created somehow. These are community members who have actually submitted this content and have tried to showcase what it is like to live in a community and deal with a specific social determinant of health. So ultimately, our goals are for every single county in Colorado to have a robust set of stories on a variety of issues regarding the social determinants of health that you might be able to take a look at and really see it from a deeper perspective what is going on in a county, but also to showcase community partners doing work with and about the social determinants of health, and if there are county-wide resources that people can actually go and utilize if they want to do activism in their communities or just honestly get to know a little bit more about their health equity data, which is really exciting. And then here's just a little bit about how we collected these stories. So initially, we would reach out to communities and organizers across Colorado and ask them to submit existing stories that they had already created that somehow related to health and health equity data. And then we would showcase them on the site. And while that's something we will continue doing in 2023, we in 2022 actually located 20 organizations across the state of Colorado, and we actually granted them $2,000 each to share 5 stories a piece. It's roughly 100 stories that we got submitted over the course of 2022, which was really exciting. And this was fantastic because it gave us a really diverse representation of not only content, but different social determinants of health and geographical contributions. Really quickly then, I would love to show you an example of a story just to put into more perspective, what it might look like to share these stories. And just as a preface, the story that you're going to be seeing today showcases data, and it's not specifically equity data navigator data, but it is data that is related to the social determinants of health. And so we love when you use the equity data navigator when submitting a story. I think that's what we're hoping people will do. But we also recognize that there is a really exciting qualitative component to creating what is the content on this platform. So it's not required, but we do love it if you can share. And Alina, I've just shared the link to the story I was hoping to share, just so you can quickly pull that up. Okay, perfect. And so this is a story from actually one of our grantees called Kids on Bikes. It comes from El Paso County. And this story product is from an organization that is essentially working to increase the number of kids who regularly ride bicycles. And the organization promotes the benefits of physical activity for children by creating pathways for youth to earn their own bicycles and toolkits. Specifically, the social determinants of health that they're focusing on are built environment and education, generally as a whole. And so I'd love if you could play the video. Thanks.
My kids don't ride bikes to school because it's too far for them to ride their bike to school. Also, safety could be an issue. The neighborhood might not be safe to ride your bike in, early in the morning or late in the afternoon.
The city is getting bigger. The crime rate is getting much more bigger. So parents like myself do not feel comfortable having their kids outside.
If more kids rode their bikes to school, I think that would definitely make for healthy habits to develop at a younger age.
Well, I think exercise is like all encompassing, right? Like the more you move and the more you work your body, the more your blood is circulating in your system, and the more your organs are able to do what they're supposed to do.
Making better food choices is probably the number one thing that people need to do in order to live healthy lives.
I think appetite and things that are in their home pantries, I think that is a a big issue when it comes to student health.
To eat lots of fruits and vegetables and to play outside a lot and do exercise.
To have your kids enjoy being outside, enjoy exercising, enjoy riding bikes.
Exercise is one of those like pillars of just like a healthy lifestyle. It goes hand in hand with nutrition.
Help your kids live healthy lives by giving them access to bikes and, outdoor activities, whether it's hiking or just walking.
To have a well-abled young one in an elementary school classroom, we need them to be able to eat right, we need them healthy, we need them to be able to move and run and play, get those brains firing. And I think all of those, come together, all of it's one.
Thanks for sharing that, Alina. And hopefully that gave you a taste of the types of stories that might be submitted to the Colorado Equity Compass. But of course, this is just barely scratching the surface. There's so much more content on here that I would love if you had the time to take a look. And now that we've shared a little bit about, what our thought process is about these stories, an example of one, have you seen any stories or perhaps even written anything in your own organization or created something that you think the Colorado Equity Compass should be featuring or maybe sharing? There is a specific like social determinant of health or something that you feel would be good to share. Always looking for those submissions.
Yeah, and Alina, thanks for sharing that link because I was hoping that you would highlight. I think you highlighted it on the page. We might have gone by it quickly, but just a way for anybody to submit their own story. And it is, we do recognize that sometimes it can take a bit to develop a story, and that's part of the reason why we have this learning series that we're going to be continuing on in the new year. But existing stories are great. Sometimes it might be a blog that somebody wrote or so they're in all formats, right? They're not just a video like what we shared, but it could be a written story or an interview that was done, or even a news piece that really highlights something that's going on in your community. So we don't have the capacity to kind of go through look at all these different channels and websites. And so we're really kind of leaning on community members to highlight those for us.
All right, thank you. So we just have a couple other sections of the website that we'd like to go over with you. And first, we're going to go up again to the top, the blue bar, and to resources, and open that up, and we'll share this page, which again is a dynamic page. We're constantly adding to this, and we'll show you a couple places where you can help us add to this page. But I want to point out there's 3 ways in which you can kind of sort this supplemental information or data. The first is right here in front of us, this drop-down screen. I'm not sure how to get started. So there's several different categorical areas in which you can just click, and it'll filter the resources for you based on that categorical area. So as an example, we just brought up the explore the connections between social determinants and outcomes. Okay. And then you can see if we go back down there to that drop down, Lena, if we take out the X, because I want to, okay, good. So then we can go over to the left-hand side and you see the filters. You can open up each one of these and continue to filter down. So just for an example, under type, Alina, if you would do video, and then under content education. So it filters it all the way down to just this one resource, why education matters to health. And then if we click on it, it'll take us to a link, which is out, which we have an internal component. And then if we click further, it'll take us to the link, which is outside of the CEC. Okay. And so again, we are constantly looking for additional resources to help us make this even more robust. And these resources, as we looked at under the filter, can be anything from blogs to video to research to stories, et cetera, et cetera. If we scroll down that page a little more, then see at the bottom, you say show all resources, but there's going to be dozens and dozens, and then hopefully more than that down the road here as we continue to add to this. So it's another way in which we want to assist you all in kind of building your case, right? Or your data story is including it with all these different kinds of research, blogs, etc. So you can send us an email. There's several places on the site in which you can do this. One is here, back up on the blue bar, you can go to the contact. And on the main page, there's also a place where you can, it very clearly says, want to have a question or have a resource to add, then you can contact us. Okay. Further down on this page, it just goes over some of the common terms. What do we mean by some of these common terms? These are just hover and click kinds of places that you can explore. And then there's two places on the site where the stories here, the stories from Colorado communities, if we go down to that and hit the read more, it brings up the community stories page again. Okay. And then Alina, if we go back up to the blue bar all the way to the left where our Colorado Equity Compass icon is, I just want to point out a couple pieces here too. So if we scroll down a little bit, this is what Rochelle went over at the beginning, but keep going down. And then right here, what is data storytelling? So if you click on this button, we have this 6-step process that was developed in conjunction with the early work of developing the CEC and with our community partners. Kind of from that work came these steps that we identified and came up with. And so we're going to continue this learning series into 2023, and we're going to go into each one of these steps in depth. Each one of these will become its own session that we hope you'll join us for, and we'll go over when those will occur here before we close for today. So we're going to go through these steps, and someone else, even the how do you even approach people to tell their stories, or how can you get those community voices into the process as well. So again, we hope you'll join us for that. I just want to point out there's a couple of places where we put some disclaimers that, as you all know, our data is limited by the collection mechanisms of the census, right? So we just want to make sure that we're both putting out that we have ethical use of data, and that that we also are aware that this isn't the 100% truth, right? Anytime we work with data, there's also consideration. We're trying to be transparent in that this isn't 100% complete, right? And probably never will be as long as we're using these varying sources of data. And then there's also this idea of ethical use of data, that we're using it with the intention of bettering our communities. And so we'd love for you to consider that as well. With that limits in the data, the question then becomes, how can we use this to as part of our storytelling, and how can we use this to enter into conversations then which again will lead to helping the common good or helping our communities. So there's many places you can get involved. We hope that you'll continue to explore and go through the site. Contact us if you'd like us to work with you on a presentation within your community. If you'd like us to, if you have a story to add, or you have someone in your community who has an amazing story that you would love to get out there to a wider audience. If you have resources that you'd like to make sure are represented on the site, that can be local or things that you've come across as you've been doing your own work, then please get a hold of us. As I mentioned, this is a dynamic site, so it's constantly changing, constantly having new features, one of which is going to be a call to action button that within the Data Navigator site, you'll be able to have links to how you can get involved with everything from policy to the politics around it, to connectors, to different folks that are doing work within that community or within that, even that census tract. Okay. So I want to show the slide where we have our upcoming sessions, and they're going to start in January. We have them twice a month, January through March. And again, those are those 6 steps of the how to tell your data story. Okay. So we'd love to have you join us. If you need a note to your boss to attend, let us know. We'll write you that. Make sure you can be here. We're planning right now on having these around the same time in the morning here, morning sessions. Okay, so this will come out to you too through an email follow-up, but if you'd like to take note of these sessions, we'd love to see you again January 11th and beyond. All right, I think it's time now for a Mentimeter. We're going to just ask 3 quick questions and give you a few minutes to give us some feedback, because we want to make sure as we're continuing our learning series that we're dialing into what you need, what's helpful for you. And that's the whole idea of this CEC site is 2 pieces. One is the democratization of data. So we want it to be readily available to anybody who comes onto the site. Another intention is that it's used to create community-based discussions and involve the community and end users of our different systems. And to that end, we want to know, are there some other ways in which we can address what your needs are? Okay, so the Mentimeter is in the chat. And it's also at the top here on this page. You can go to www.menti.com and use a code, and then that'll help us. Great, thank you so much. It's really helpful to have your input.
This is great. This really helps inform our work, because part of what the trust has asked us to do is to find ways to be supportive to Colorado people, like any one of us, around how to really leverage data and data storytelling in our communities. And so this helps us to understand what things are of interest to you, or where you're finding some sticky points, or where you have some particular interests like housing or substance misuse. This is really helpful.
So this question, we can turn back to the site, like if there's tools within the site that I know someone had mentioned earlier, could we compare 3 different or more than 2 counties or geographical areas? So if there's other things that came up for you as you were looking, ideas or additional tools on the site, or tools that could be parallel or accompanying this, let us know.
And sometimes ideas just kind of pop up as you go further into the site too. So this might be one where you're still learning and don't know yet all the functions that the tool offer, that the platforms offer. But if you have particular questions that you think would be interesting that you're not seeing yet, we'd love to know that.
Yeah, the response for the census, it's interesting. I think they just released some data on that, on the percentages. And again, this is people who responded in what they identify as households. So we can take a look at that for sure.
And Scott, the question around historical aspects to the data, kind of being able to look at things over time, is one that comes up often when we're sharing this information, and we're still trying to figure out how to do that. So I did mention that the Equity Data Navigator was recently updated to include more of the 2020 data as well. And so we did archive what it looked like before this update. And that's just something we're probably trying to figure out how to do that in a way that doesn't get confusing for the user too. So that's something we're exploring as well.
Mhm.
Great.
Yeah, I appreciate that feedback on the systemic inequities, and that's one of the development pieces we're talking about with this learning series is an opportunity to do some deeper dives as a cohort into what are the inequities, what's the historical context of systemic inequities within these systems, how do they collide together and intersect to create the conditions in which folks are living in, right, and working in.
One of the interests at the beginning of this project was really around how do we incorporate or highlight racism as a factor in health inequities, right? And so we've been trying to figure out how to do that a little bit more so that the user can get to that easier. One example was that we were trying to look at, for housing, somebody mentioned going deeper into housing, we were trying to look at redlining data. Like, would there be a way for us to kind of incorporate that into a particular county so that people could see that and the impact it's had on health for different communities? So it's definitely something that we want to highlight, and we're trying to figure out how to do that with the data itself. So a guide is kind of an interesting idea, like how, again, it's how to be critical users of data.
And I think that's one of the reasons too why we, in an earlier iteration, as Scott said, this platform is continually evolving. And in the most recent update, we were able to add specifically like race and ethnicity around educational attainment and around median family income, recognizing that it's not equal amongst all that are within the same area, and wanting to better illustrate, not fully illustrate, but better illustrate kind of the experiences that are happening there from that kind of systemic inequities that we can recognize are occurring. But again, with not having a lot of background behind the data, some might draw incorrect or make assumptions about the data that we don't necessarily want. So we think just continuous education and really being critical about what our data is saying as well is really important, and something we're hoping to foster through some of these trainings, and then also potentially like a development of some sort of tools or guides.
Mm-hmm. Thanks, Elena. Yeah, I think we can go on to the next question.
Yeah, so is there additional data that you'd like to see represented on the site, or connections to other, again, to other sites? We're looking for partners. We're looking to just keep the dynamic, as we said.
We were on a call a while ago with some folks from Boulder County, and one of the participants works in dental health. And so she was encouraging us to look for dental data because oftentimes dental is kind of the gateway to good health, right? And so I have a dentist appointment this afternoon too. So I was just thinking about that, right? That, you know, we had originally had just overall health as an outcome. And this last round, we updated it to include mental health, because mental health is essential to good health. And so, you know, always trying to think about other sources that community members are interested in. So more data about youth. Yeah, that'd be great. And we do have a couple of indicators in there around youth engagement. But I do think that would be important to help highlight. All right, I know people are starting to have to leave, so we should probably go. We'll keep this running. If you have additional ideas, it's still going on, but maybe Scott, maybe we move over to Eve for wrap up.
Yeah, we just have one last slide and we'll close it out here. But on behalf of our team, again, thank you so much for joining us today. And and your presence from all over the state. I hope you had a wonderful experience with us. Again, if you have stories from your community or through your work that would be interesting to have on the site, please let us know. You can email us. You can also email us with questions. You can subscribe to our social media through the CEC has our own Facebook and Instagram pages. And you can also join our CEC mailing list. So once again, we'd love to see you in the new year with our 6 sessions, which will be building off of each other, going through those six steps to telling your data story. And team, anything else?
Yeah, I will send a follow-up email to this meeting, and I'll have that information there for you, as well as just some links to the things that we mentioned today, just so it's a little bit easier to navigate as a follow-up. So thank you all so much. Deeply appreciative. And yes, once again, if you have any questions and or stories or resources to share, always accepting those at the hello@coequitycompass.org email, and that follow-up email will have the direct links to the Facebook and Instagram, because we love sharing them out as well, and we hope that you could share the stories and resources that we put on our site as well. So thank you all.
I just want to, one last thing, I just want to invite, if you have colleagues or community members that you work with that speak Spanish, we will continue to provide direct translation through in our sessions in the new year. As well as the closed captioning. So we hope that we can increase the number of folks here, and please invite others. And again, thank you so much. Wonderful to have you with us, and enjoy the rest of your day. Happy holidays, happy new year. And we hope to see you January 11th.